We're preparing to broadcast live on YouTube. Give me a second. Give me a second. Okay, we're preparing to broadcast live on YouTube. Give me a second.
All right. Good evening, everyone. Welcome to Know Better, Live Better with NRWP. Tonight's discussion will be health disparity. I thought you hit that already. So here we are once again. Thank you for joining us this evening. My name is Andrea Early. And just to open up, social detriments of health. The weight of social detriments of health in communities that are under-resourced, underserved, marginalized, and rural has also taken a toll on health and well-being of New Yorkers throughout this current pandemic. Children have lost their parents due to the deadly disease known as coronavirus, COVID-19, and have been forced into placement or have stepped up as the head of households to prevent siblings from entering into the foster care system. Individuals suffered from food insecurity, loss of employment and housing. When your basic needs are unmet and systemic racist policies such as redlining, medical treatments and vaccine trials contribute to discrimination, we have to look at some of the things that we need to address. During the pandemic, communities across New York State have mobilized both formally and informally to bring resources into food deserts, provide education around eviction, moratoriums, affordable housing, and empower individuals to seek access to services where they can be seen, heard, and understood. COVID-19 put residents living in multi-unit, overcrowded housing and the essential workforce at high risk due to increased exposure where they live, work, and play. Ladies and gentlemen, welcome once again to Know Better, Live Better. My name is Andre Early, and for those who don't know me, hey, here I am once again. I serve as one of the trusted messengers for this evening, and we are also joined by the Know Better, Live Better staff members, Farrah Cater, as well as medical professionals from Westchester County's Department of Health, Dr. Dow Hewlett, Kwaku Quisette, and Erica Williams. Right now, I'm going to turn this over to Farrah.
Hi, thank you. I'll be quick. So I just want to say thank you all for coming. CAPA is a trusted partner with the Westchester County Department of Health on this federally funded program. Before I turn it back over to Andre and Robert, I'm going to put a couple of survey links in the chat. These are voluntary anonymous surveys. The purpose is to collect information for basically a research study that we're conducting about the effectiveness of this kind of trusted messenger-based, community-based, health discussion-based program. So we will ask a few questions about health behavior, attitudes and beliefs, and your experience with the healthcare system and health providers. There's a little bit of COVID-19 focus in the survey, but please don't let that discourage you from asking other questions or making comments about other health topics. Again, it's confidential. The researchers reviewing the survey are us at Westchester County and at our Mercy College. If you have questions, comments, or complaints, you can reach us using the contact information on the first page of the form. If you participate, your responses will be submitted and saved on a secure server at Mercy College. Anyone who looks at the survey responses must keep them confidential. When the data is analyzed, there will be no emails attached to the results. However, I will use your email that you used to register for this Zoom conference to send you a $10 gift card from Amazon.com. This gift card is to compensate you for your time and participation in the information session, not for survey completion. You will still get the gift card if you leave survey questions blank or if you do not want to fill it out at all. So I'll put that link in the chat now. At the end, there will be a shorter kind of evaluation survey, and I will also include two handouts that just have key takeaways from this program and some resources for you to save for your own needs. Thank you.
Thank you, Farah. We greatly appreciate it. When we started this journey some months back, just to give everyone a refresh, or for those that are here with us for the first time, this program is being run in different communities around Westchester County and beyond, in collaboration with the local health department and different organizations such as NAACP chapters, Family Services of Westchester, and other social and community-based organizations. We are also bringing it to you here so we can have some tools and information to help with making health decisions. We will talk about health overall, but this evening we will be covering health disparities in light of what's been going on with the current pandemic and of course beyond. So with that being said, I would like to pose a quick question so we are all on the same page, to Dr. Hewlett, or I will assume Dr. Quist. I'm going to get this name right. I apologize.
Yeah, it's Quist, but I'm a nurse. I'm not a doctor.
All right. Thank you.
Okay.
So the first question of the evening, what are healthcare disparities and why do they matter?
I'll start and then I'll turn it over to Kwaku as well as to Erica. Disparities in health are inequities or differences, that is, between populations. And I think that it's very well known that African Americans tend to suffer more from a number of diseases, chronic diseases, and we were disproportionately impacted by the pandemic. And these disparities then have resulted in higher death rates, higher rates of what we call morbidity. And also these disparities essentially are created for a number of reasons. And I think that you're going to go into some of these, some of the things we talk about, like the social determinants of health. One of the reasons why we're having this program is that it is believed that many of the disparities that are occurring among members of our community are traced to a lack of information. And so this is actually an effort to improve health literacy in our communities, and to start by using trusted messengers like Mr. Early and like Mr. Bowen, people who you know very well, who have learned a lot over the last few weeks about health and about various aspects of health, including COVID, but also including many other things, and who can give you information that's going to be helpful to you and to your families in terms of keeping you healthy, not only with regard to COVID, but other things as well. So that is kind of one of the things that we can say about disparities.
Thank you, sir. Thank you. Would you like to add anything to that, Kwaku?
Not really. I think the Dr. Hewlett has summed it up, pretty much well. So there's really not much I can add to it.
Okay, thank you. So it's odd, ironic that I just received an article from my sister just yesterday, everyone, and the article was interesting because as we look at our people and our demographic and what we've been experiencing over the past few years in regards to the pandemic, it appears once again that there was a little snafu in some type of medical equipment. And this article was referencing the pulse oximeters and how it's not reading the information correctly when it comes to those that are of darker hues. Right. And then I don't know if some of you have ever experienced something like I do on a regular basis when you go into a restroom and they have the handless soap dispenser. I catch the devil trying to get that soap out of the dispenser, and come to find out that that could be part of an issue as well. And when it comes to the development stage of this type of equipment, does it take into consideration of those that are of darker hues and those that are in our demographics? So this, you know, all ties into disparities that take place within, you know, our communities. Kweku, since you're a nurse and
Can you go over the soap dispenser example? Because I'm a little.
okay, so with the soap dispenser,
trying to-
some of them are hands-free, right? And so if you wave your hand or you put your hand there, I've
Right.
literally stood next to someone else, no issues. I go in, I have issues. I go to the same soap dispenser, I still have issues. Is it a coincidence?
Sometimes some of those soap dispensers don't work well, to be honest. I've had, you know, people have problems with it, you know, many times, and I've had problems with it. And there are some that are very efficient. You know, the least motion and it squirts a lot of soap. So I don't think that's due to a hue.
You got it?
The skin,
Some of you.
but it's probably the sensitivity of the motion detector.
Okay.
That's probably what it is.
So now let's go back to the to the pulse oximeter.
I've heard about that, but to be honest, I haven't had much experience with it.
Where's Mom
When
at?
I was working as a nurse in a hospital, I never had a problem with it.
I think one of the concerns about the pulse oximeters was that if you were getting a falsely elevated reading because of factors such as skin color, that might lead then to disparity in terms of the treatment of the person. I think that was one of the concerns that was raised. It was unclear as to whether this actually resulted in clinically different types of therapy. But I think the overarching issue here, Mr. Early, is the medicines that we use, the equipment that is used, the various laboratory tests that are done. A lot of these things are, they have to be approved by the FDA. And one of the problems I think that we face in this country is that there's an underrepresentation of people of color, African Americans and others in the clinical trials. And so when the clinical trials are done, the results that you get are based upon those that are of the majority, let's say the white community, because those were the subjects in the trial. This came up, of course, with vaccines. There was a concern initially about, well, what percentage of the people in the vaccine trials were African Americans? Were there enough for us to be able to conclude that we would benefit just as much as the other communities or the other races? The same was true with the adverse events. Would we have more adverse events than other groups? And can we say that we have more or fewer, but were there enough people represented? So I think that one of the things that this does raise is that there should be equity in terms of the enrollment of people into these trials. That's kind of the overarching issue.
Definitely agree. Definitely agree. Did you have something, Rob?
No, Brother Early.
No, I was trying to find your number to text you to say, I'm waiting, but
From time to time. Okay, so when it comes to education, how important is health education, and how do we rebuild the trust, specifically within our communities, during this pandemic. As we can see, news reports, we're going back up in regards to the new variant. What is this going to look like throughout the summer, as some of us, unfortunately, are attending super spreader events? What's it going to look like during the fall when the kids go back to school? What can we do? What is available for us to ensure that we continue navigating through, these crazy waters?
Well, I'm kind of hogging things because I know I have to leave the call a little early, but I'll just chime in right now and say one of the biggest problems that we have in our African American community is misinformation or disinformation. Unfortunately, a lot of us rely on the internet for our health information. And there is certainly a lot of excellent information available about health on the internet, but then there's also a lot of information on the internet which is false or misleading. And it is very difficult for people who don't have a background in healthcare and in science to sort out what is good and what's not good. And so that's one of the things I think we can, through programs like this, we are trying to inform people as to what are some of the reliable sources of information that we can seek out to help us with maintaining our health. What are some of the keys in terms of sources that might be false sources of information or sources of disinformation, where if we follow that, it might be harmful to us. And of course, a good example of that was a lot of the misinformation around the vaccine. And we, unfortunately, as a group, disproportionately followed a lot of that information. And as a result, a large percentage of our population decided not to be vaccinated and not protected. And as a result, we saw higher death rates and higher rates of morbidity in our population. As time went on, though, I think that people caught on. So I think that through programs like this, the kinds of information that you as trusted messengers are trying to convey is what is going to turn things around a little bit. And if the people that you reach also understand what the credible sources of information are, they then are also going to be able to pass that information along to others. The other thing I think that we have to encourage, and you have been encouraging this through the discussions Mr. Bowen has had, is critical thinking. I think that we all have to question all of the information that is being provided to us. Where did this information come from? Why is this individual providing this information to me? Are they trying to sell me something? Are they running for political office? Is there some other reason why they're giving us this information? And where did this information come from? Did it come from somebody's uncle who was sitting in a bar talking over beer? Or did it come from some reputable source like the Institutes of Health, National Institutes of Health? So these are some of the things I think that we also want to try to work on.
Yeah, this is Charles. I think it's very critical because what happens is, I'm an educated person. My wife works for Westchester Medical Center and it is, a high-level executive job. And all of these reports that you hear about, all of a sudden, this pandemic is coming mushrooming again. We don't know how to attack it. We don't know what we have. Do we have the medication and stuff in place? How are we going to distribute it? And this isn't just a Black or Spanish situation. It's across the board. You have no idea who to believe, who not, who's spreading it. I ended up getting, I got the COVID again about 30 days ago. Yes, it was asymptomatic, so I wasn't, admitted to the hospital. But the question becomes is, who do you believe? And I'm struggling with that myself. So, somebody's going to give me an answer, a direction or something.
And ironically, and thank you actually for bringing that up. And again, good evening, everyone. If you don't know, my name is Robert Bowen. I am the other trusted messenger. And of course, I don't like to speak, so I'm gonna be very brief. And what I'm the reason I'm speaking now is because the point that you brought up is that who can we trust, right? And just a little clarity, I work with our disenfranchised population, which is families, mothers, children, husbands that are in shelter, that are doubled up, foster care. And one of the biggest things that wasn't really talked about was, and that's really never really talked about, right? But we all know that it exists, is that the inequality of healthcare and the inequality of information. So you're trying to tell us that we all need a vaccine or we all need to do this, but are we all getting the same kind of healthcare? Are we all having access to the same doctors? And quite frankly, it's platforms like this, the Know Better, Live Better, and doing these kind of community forums where parents, people in our community, if you have a question, and as of right now, anybody on this panel, if you have a question, please put it in the chat. But if you have a question as far as to what community-based organization you could speak to help you get better healthcare, or, I'm not really confident about the vaccine, or what variant should I be worried about? Okay. Rather than going to the news or going to the internet, forums like this, where you can speak to trusted messengers like ourselves who are in the community, not someone from a TV anchor spot, ABC News, Fox News, MSNBC, but people who are actually on the ground, okay, that you can speak to, that actually live it and see it every day. So to answer your question, brother, it's forums like this where if you're looking for answers are some of the best ones, because guess what? The answers that we give you now aren't from somebody who isn't in your community. They aren't from somebody who isn't, dealing or doing the things every day. Okay. But with that, I'll turn it back to Brother Early.
Thank you, kind sir. So with that being said, so as we look at other factors in regards to health disparities, and some of us are sitting here in, community-based organizations. So we are doing community outreach. We are working on the front lines with quite a few other agencies to make sure that our communities are taken care of. Let's look at community safety and social context. Can we trust the government resources that are in place? And that's a question that came up. And if not, then who? So here it is. We just mentioned that we don't know who to trust from time to time. Now it's one of those situations where things need to be addressed once again right now. I believe some of our local municipalities are putting back the mask mandates when it comes to entering into municipal buildings. So they're trying to be proactive, I believe. So who do we trust? What can we do? Erica.
So good evening, everyone. I just wanted to say that a lot of the topics that was already talked about, the economic stability, even the neighborhood and the physical environment, education, food, and now you bring up the community safety and social context. It all kind of continues to go in a circle. It's like you can't leave one without the other. I think health literacy is very key. Yes, platforms like this is important. We only build trust through trusted messengers such as yourself and programs like this. But literacy has to do with, again, where do you find your information? So the Know Better, Live Better program is trying to equip the Westchester neighborhoods with the information that they need. I do believe that there's a guided resource. I don't know if you've dropped that in the chat yet, Mr. Bowen or Andre, but there is a resource that was gathered together for people to actually go to for some help for different types of resources that they might need. And it's when other people are experiencing the same situations and conditions that they can help one another. When we talk about who do we trust, and why do we trust them? Again, a lot of people, it really had to knock on their door. I'm going to speak about COVID because that's kind of like the background of this conversation. It really wasn't until somebody actually had COVID. Even right now, if you have COVID and you was vaccinated, people still say, well, you said you should get the vaccine, but you still contracted COVID. Well, the truth of the matter is you might have contracted COVID, but you wasn't as sick as you would have been if you didn't have the vaccine. And so understanding that, and that goes right back to, again, like I said, literacy. So when you think about the social deterrence of health, everything is kind of like connected. The neighborhoods that we live in, do we have access to adequate health care? Does a person that's an immigrant even feel safe going to a community center or a community resource to get the health care? A lot of people don't realize that you can go to a Department of Health or you can go to an open clinic and have free cancer screening, free mammogram, free pap smears, free prostate screening. And if you are unfortunately, diagnosed, you will have the resources to actually, be seen. But a lot of people don't know that there's a lot of free help out there. So it's all about being able to identify all of the deterrents of health, putting all the resources in place, educating people wherever they are. So Mr. Bowen said in the school system, that's huge. We do know that there's parents and parents have children. And so that's one key resources. And then we have a lot of community centers and we have other CBOs such as churches and other non-for-profits that can help to assist in some of this as well. So trust is built on relationship.
Yes, and
Thank you. Care to add anything, Kwaku?
Well, yes. So as Erica indicated, one of the sources for help is your local health department. If anything at all, they'll be there to redirect you if they are not able to accommodate your needs. But you can start there. That's a great starting point. Instead of going to the ER where you'll be tossed, it's likely you'll be tossed around without, recourse. So your health department, it's a good place to start.
Great, thank you.
Can I just say, just real quick, I guess part of I hear the misinformation, who to trust or whatever, but I think the other part that's happening now is COVID still dangerous? Meaning, like the other day, like right now, you heard is COVID for the last 2 years, and it's in 2020. And then, the numbers were thousands of people were dying, blah, blah, blah. But then the other day I heard there are like 300 people in the hospital. So in my mind, I'm going, well, is this still this pandemic where everybody is all up in uproar? Because then, of course, you look at TV and everybody's out and about doing whatever. And then I had to go to my family, had a 4th of July thing, and my wife's birthday is the 3rd, went down to Atlanta. Airport was packed. Nobody was wearing a mask, and everybody was going about their business. And it almost seems like, well, you keep hearing, and then if you go to media, some stations don't even cover it whatsoever. And other stations, it sounds like, well, they're like, oh, COVID's on the rise. And in other news, the Yankees lost last night. So even there, the severity of it doesn't seem like what it was. So I think the people just follow suit at the same thing, saying, well, COVID's in the back of my head, but you know what? I've been locked down for 2 years now, and now it's time for me to get back out there because everybody else is doing it. I don't want to let another whole year go by. So I don't think sometimes it's, who do you go to, who do you trust? But also, I think it's also people are in a stage of, for lack of, they're tired of COVID. They're tired of having to have to go to the conversation. You know what? I've done everything that I can. I've gotten a vaccine. I've been boosted twice. I still caught COVID. So you know what? I've done all the right things. I've done all I can. I got to get on with my life. So it's kind of like, what else you gonna do? Like I hear, this new strain's coming, and I'm saying, well, I don't know what else I could do. I've done everything. So you know what? I just got to go with what I've got. I've done the best that I can, and just going to keep it moving.
Well, Derek, your name is?
Correct. Yes.
Yes. So, yes, one thing that we have to understand is this virus is very new, to us, to everybody, to the scientific community, and to the rest of the world. So information, technical information, epidemiologic information is still evolving. They're still, studying this virus and its impact on populations. It's going to take a while for us to get a good grip on this virus. But even then, it might evolve just the same way that the flu virus has evolved, which comes around every year and mutates somehow, and they try to get a vaccine to control its impact. So that's the prediction, that it might go in that direction, because it's mutating every so often. As far as doing whatever you can to stay alive and live your life, yes, you have to do the best you can. You have to isolate. You have to, if you qualify for vaccination, get your vaccination. The vaccination is not to prevent. It's not 100% prevention of ever getting COVID. No, it's to reduce the seriousness of the illness if you should get it.
And I agree, but let me tell you what happened. So just to say, you could, in this country, right, you consider the CDC the expert, right? That's what I consider the expert.
Right.
In May, my son caught COVID. 3 days later, my daughter caught COVID. And I said, maybe I should get COVID, get it out the way. But I didn't get it. My wife came back from out of town. She caught COVID. So I said, well, I haven't caught COVID. Let me see. So I called CDC. And CDC said, well, okay, your son had caught COVID. So you've been exposed. I said, yeah, my son caught COVID on a Friday. My daughter caught COVID on a Monday. Then my wife caught COVID that following Saturday. So I said, well, what does that mean? I said, now I've been exposed and I'm in that 5-day window, almost a moving 5-day window. My son, my daughter, then my wife. And my wife tested positive on a Saturday. I said, well, what does that mean? Do I go to work on Monday? So the CDC said, well, let me look it up. And then she came back, she said, I think you'd be okay if you go in on Monday. And I'm like, you're the CDC person, and you just told me, and I told you I haven't caught it. And you're the CDC expert, and I just told you that in my house, that it's contagious because my son had it, then my daughter caught it, and then my wife caught it. But now you're telling me it's okay, you go to work.
But did you test positive yourself?
No, I did test positive. So in other words, I could have caught it, and the thing with COVID, of course, is when you catch it, you may have it for a day or two before you go get tested.
When were you last exposed to somebody who had it?
My wife.
Okay, how long ago?
This is in May.
Oh, this is in May. Have you ever tested since then?
I test on my own because I go into the office. So if I know if I'm going to an event or anything where I'm gonna be around people, I always test myself like the day before, so that I don't want to be a super spreader. But but that's just what I do.
Right.
Let me, before we get, can I speak? If it's okay?
Yeah. Okay.
Because I don't want to go this bantering back and forth, right? Because there's some things that are on the table, right? And I know every time we come to these forums, we talk about the impact that this has on kids, right? And what's happening with them. rarely ever do I hear about, particularly in the educational forum, and I'm a New York City Department of Education educator and have been for a number of years, and I don't hear about the impact that it has on those people who are in the educational system, right? And the impact, right? And I found, contrary to all the information that continues to come out about the impact that it has on students, what the impact that it has on the adults. And one thing that I do know is that if the adults are impacted in a negative way, how can they be there for the students that they are serving on a daily basis, right? When a whole year has gone by and now we're asking adults to be there for students, how can they be when they were impacted in negative ways in terms of how they serve our students? How can they be there, right? After 2.5 years, caught COVID. I had COVID last week. I tested positive, right? After 2.5 years. But, and I don't know how important that is, but I would say that, and I'm double boosted and the whole nine. So I understand what Miss Williams say when she talked about, the education around that stuff, and that's fine. But the adults who are being impacted by this pandemic and how they are continuously being asked to serve those who we're coming up with the data of they're being impacted. I see kids, and kids seem to be fine. They're resilient, right? They can get over this stuff, and they have shown to do so. But we don't talk about the adults who are impacted in negative ways about this.
So to your point, Brother Caruso, believe it or not, that actually segues into our session next week when it comes to mental health. And that's where we're going to address all of that.
Yes. Hey, Irvin, how you doing? This is Charles McFarland. And I just wanted to say, I understand what you're trying to say. And I also understand what the impact is. And I followed all the right rules. And I try my best to do the right thing and not to spread it or whatever. But, at the end of the day, I look around this little audience we have here, and some of us are getting a little older. Some of us are in the fourth quarter of a football game. Okay, so what am I supposed to do? Just end my life now? Or should I continue to do what I'm doing the right way, but also realize I'm not going to be here 25 years from now? But the children's concern is very, very important to me. So, the more we educate them, the better it's going to be. So that's my 2 cents. It's a tough situation.
Yes, it is.
Thank you.
Yeah, yes, it is. And with that, segue, we've all witnessed and seen and been through the difficulties of the last 2 years. But with that being said, and that's why forums like this are so pivotal, okay? Where this isn't Fox News, this isn't CNN, and we are not here to just talk to you, okay? As I've stated with Brother Early, every time we've had and put on this Trusted Messenger forum, this is a conversation, okay? Where your questions, your feelings about what's going on, about the vaccine, and now to the inequalities in health and health disparities, this isn't us just talking to you. This is us having a conversation about that, okay? So with everybody, I want you all to feel and know that these kind of conversations we have here at this forum, because this is what it's about, okay? We have not only health experts here, but we have people that are on the ground, working in education, working in the health field, that whether they caught COVID early or they caught COVID late, or if it was somebody like myself who was very hesitant to get the vaccine, but then actually ended up getting it because I looked at my mom and I said, I'm gonna do whatever I can to make sure that she's with me a little bit longer. Okay. But with that being said, because, this forum, because we all have something to say, we all have an experience, we all want to chime in, and we're going to get to everybody. So with that, any question that you have or a sentiment that you have, put it in the chat and we're going to get straight to it. So for instance, I saw earlier in the chat, any of our health experts, please feel free to chime in. But the question was, as far as when it comes to the second boosters, are they needed? Yes or no? And if they're, what's the logic as far as behind the second boosters? Should it be more like age-based, or should it be more of like age-based and pre-existing condition-based, or should you just get a second booster? Okay.
I'm going to say that it should be both, combination of both. And again, it's about, why should you have a booster? When you think about immunizations and how we've had them throughout our life, there's some vaccines that we have to have boosters in. This is nothing that is nothing new. It's just that, as Kwaku said, COVID is still new to us. But the concept of vaccine is not new at all. And because of vaccines is why we have a lot of people still here, even from the 1800s. And the evolving of medicine and evidence-based practice is what continues to go on. So we do have CDC, and I understand, what Derek was saying about, I go to CDC and I ask them this question and they're not sure, and they're not sure because it changes a lot. But it's kind of a window of different things that you look at. You could look at World Health, because New York City is considered like a melting pot. A lot of people come here to visit and tour. This is like the place of opportunity. We have a lot of immigrants that come here. And so because they all come here, it would be wise for us to see what's going on outside of the United States. It would be wise for us to see what's going on in Europe. When COVID first came, they thought that it was coming from China, and it wasn't from China. It was actually coming from Europe. And we didn't know that. And so just kind of like looking outside your own backyard and doing some own, education at your level. We're not asking people to be scientists, but we do, have, as Kwaku said, we look at epidemiology studies, we look at numbers. When we think about what is the real threat with the COVID that's coming up now, we just really have to stay guarded. We have to stay mindful. It's an excellent thing, Derek, that you pre-test yourself because you don't want to be a super spreader. That's super, super, super sensitive and considerate of society. We should have more people like you who are not tired of COVID and who just want to go out and have a good time. We're all tired of COVID, but COVID is not tired of us. And so if people were a little bit more considerate like you were and tested yourself before they went out, we might not have as many numbers. I will say that the numbers are existent. People are just not testing and people are not reporting. A lot of people are getting sick thinking that it's probably a seasonal allergy or it's a cold because they slept underneath the air conditioner. And again, our children are very resilient. They bounce right back and they can be spreading COVID. So it's just about being wise, being mindful of everybody else that's around us. I also saw that there was a question, and Farah actually put direct information to David, I believe she was addressing about the booster. So you could check the chat about when you should. You could even be boosted after you have been exposed to COVID, even now recently, as long as you're not asymptomatic, right? So once you come out of that asymptomatic of feeling sick, you are eligible to get boosted. A question that might be in somebody's head, will we have to continuously get boosted? It's just like the flu vaccine, because it's a new strand, it has to be readdressed. And just like most vaccines, you have to get another exposure to it so that your body is built up. I did see somebody ask a question about underlying conditions, having pre-existing conditions. What does that mean? That means a lot, because when you have pre-existing conditions, you already have two hands out of the fight. So here you are battling diabetes, you're battling, maybe COPD, chronic obstructive pulmonary disease, or maybe you have an immune deficiency such as lupus, or anything else that your body is already at war with. Now here comes COVID and you have no hands, right, to fight COVID. And so those persons that were, maybe obese, maybe underrested. It's just like if you got a cold, a cold could be in the same atmosphere, but because you got 8 hours of sleep and somebody else got 2 hours of sleep, that immune system is already down. So you might handle that virus that was in the air where the other person, might not. And so it all depends on the person. COVID is very individual. It's a multi-system, attacking disease, which means it can affect different parts of your body. So if one part of your body is already at war, such as, having an obese belly, or having COPD, then breathing is a little bit more challenged for you. Again, or if you're already struggling with, cancer because you're already immune suppressed because you're getting chemo or radiation, again, hands out of the fight, okay? Or diabetes, because diabetes is another octopus of a disease. It affects your vision. It affects your limbs. You could have loss of limbs. You can have amputations. You can have kidney failure. And so if your body's already, again, at war in all those different areas, then you do stand a chance. So underlying conditions play a big part, which is why we talked about health awareness. We also talked about food, the food that you eat. So community-based organizations, we do need to consider the foods that we have. Now, I will say this because this goes to health disparities. I was in the Bronx, right around, I guess that's Jerome Avenue. No, White Plains Road. And I just wanted some plain spinach. And the spinach that was there at the vegetable stands, very poor, very wilted. It was, I would not have brought spinach from that vegetable stand. But if I went to a Whole Food or I went to I don't know, a Trader Joe's, or I went to another, vegetable stand, it would not have been the same. So in our communities, we are challenged with fruits and vegetables. It's a challenge. So I think that's also some of the areas that we need to look at. What are we actually even providing, to the communities so that they can have, so that your body is not already, at risk, for not having the proper nutrients that you should have.
So, I know y'all gonna move on in a minute, but I do need to thank you, Ms. Williams, for all the information you just provided. And I get all of everything that you just said. But I would also add to the conversation that, to your point, literacy is important, right? And, how we access this information and be able to share with our communities are important. And I would also say that, being vigilant about this situation and being careful about how I enter in certain situations has allowed me to stay away from COVID for 2.5 years. And all of a sudden, the day before I was supposed to go away on a trip with kids, I tested positive.
Mm-hmm.
I can only think about, and this was July 4th, right? And here I am celebrating and feeling like, wait a minute, I'm just trying to recover from a day of celebration, but let me test to make sure that I don't go on that trip, get on this bus with all these other people to affect them. And I tested positive. I couldn't go on a trip a couple of hours away from getting on a bus to go with, and so we have all of that stuff that's going on. And I understand what you said, Mr. McFarland, and that, the kids are important and this, that, and the other. And that's what I'm there for, right? And that's why I do all the things I do to protect our communities, our kids, right? However, I just say this again, and Brother Andre, you will take this up, and that, our segue into next week is how do we care for the adults who are experiencing the impact of all of this that we're dealing with, be it testing positive for COVID, being the inflation that's taking place, the communities that we're involved with, and continuing to do the work that we need to do as adults in our communities, the adults are highly impacted, and I'm not hearing a whole lot about what we need to be doing for them.
I hear you. I definitely hear you, sir. And that will be taken up. And I know you have to leave, Erica, for another one. However, I had to go into the chat. Can we just make sure there is a question I would like to see addressed, Kwaku or Erica? When we do test at home, what is a reliable source to report a positive case? Now, what is that process? Because if you test at home, that's one, marker. Do you go to your physician?
Yes.
Or, there you go.
That's correct. You go to your provider and inform them that you've tested positive.
Mhm.
Yeah, and they will take it from there. And if you are symptomatic, they will give you treatment. If you are not symptomatic, you just isolate and take all the precautions that you can so that you don't spread it, to other people, other individuals. But the important thing is to immediately inform your provider, because they have to report it as well, because all these tests, all this information has to be reported so that the CDC is able to keep track of it. Yeah, so it's important.
Great, thank you.
Brother Early, I just wanted to address, there was one more question in the chat. As far as Ms. Griffith, what she asked as far as addressing the disparities, okay, when it comes to health disparities in our community. Make sure I get the right, I just had the question in front of me.
Yeah, I believe she wanted to address the health disparities around chronic conditions, which Erica touched on in regards to diabetes, heart disease, things of that nature, and of course, mental health for next week. Right.
So to answer that also, as far as the Know Better, Live Better website, okay, the link is in the chat. Again, I would definitely point everybody to that link. But the reason why is because with all the social media, with all the media out there, it is kind of confusing to figure out as far as what. So now this Know Better, Live Better website, you now have that source, okay? Not only that, and I've spoken about this in our previous sessions, but we all understand that there are inequalities in this country, right? Not just health inequalities. But what I would say to everybody on this panel, okay, specifically if you are looking for something that we just talked about as far as healthy food, right, in your community, or like living in the Bronx, which I actually work in the Bronx over by White Plains Road. Untapped resources such as community-based organizations or even your local school that you send your children to have a plethora of information that you could use. For instance, if you send your child to any school, that school is going to have a social worker. Social workers are tapped into the community-based organizations in their area, okay? Not only that, those community-based organizations, if they don't provide what you're looking for, can point you in the right direction. All right. So these are just other avenues that you can use that you probably didn't even realize. Where it's like, hey, if you're looking for fresh food, because I've actually had parents in my community, hey, I'm trying to look for fresh produce. I know of a community-based organization right here in the Bronx that does that. Not only that, we're growing fresh produce right here at our school. So it's things like that where these untapped resources that we don't know of, right, are simply right here at our disposal. But sites like Know Better, Live Better, okay, where you don't have to figure out, do I need to go to this site? Do I have to go to this app? You can go to one central location. And does it have every community-based organization in Westchester? No, but it's a great starting point. Okay, and with that, Brother Early, I'll turn it back over to you.
Thank you, thank you. And when it comes to specifically like food and nutrition, some of our local municipalities are trying their best to address that. So if you look at some of, let's say, like City of White Plains, Town of Greenberg, and other municipalities, they actually have fresh produce farmers markets that take place once a week throughout the summer, like late spring and early fall. So check your local municipality to see if they have a local farmers market taking place within the downtown area. I've also noticed in the chat that there a back and forth, a nice conversation in regards to COVID versus the flu. Just a little quick anecdote. I caught the flu back in the early 90s, and let's just say I did not do well at all. And ever since then, I actually started getting the flu shot. In my mind, after processing these past 2 years and dealing with COVID, I am strongly believing that that's going to be added to the list of shots on a yearly basis. I'm pretty sure that's going to be the case. So it's just the nature of the beast, and I'm going to try to stay around as long as I can. So we're going to use the proper resources and tools to keep that in play. I wanted to share something with actually a question with Kwaku in regards to the healthcare system, and that question is there anything in place? And I guess we do know the answer to this to a certain degree, but is there anything in place to help navigate people through the healthcare system with, as we all know, has so much red tape that is in place?
So that is a very broad question, but the gist of it is that yes, there's navigation. And when you go to a hospital, there are people who are employed specifically to help navigate, visitors or patients through the system. They're called social workers, they're case managers. They are the ones who are supposed to help you navigate the system. So yes, and like Erica said earlier, when you go to a school, they're social workers and they help point you in the right direction as far as resources are concerned. All kinds of resources, from mental health to nutrition to medical, anything that you can think of. So yes, there are various points of help that you can tap into as far as navigation.
I can add, there are patient-centered medical homes. They do take place in, like Kwaku said, in hospitals and medical centers. West Med, I think, has one. Westchester County DSS, Social Services, also has a hotline for navigating through insurance. The limitation with patient-centered medical homes is that they are often tied to income eligibility, but there's often more expanded opportunities for children who have certain conditions or receive SNAP, WIC, or Medicaid. So I can drop a couple of links in the chat regarding that.
Perfect, thank you.
Listen, I don't mean to be controversial, but I will for this purpose. We're talking about these different resources that are in the community. We're talking about schools and social workers and people who should know how to refer you to the proper sources to get all of this stuff that we're talking about. That's not always the case. Sometimes these people don't even live in our community. Sometimes these people are not connected to us to be able to tell us what to do, right? they're connected to their own communities. And so we have to be careful with that. It's nice to say that they should be able to do those things, but that's not the case. Listen,
So,
I've been part of the New York City Department of Education. Oh, excuse me. Let me finish. I've been part of the New York City Department of Education for over 2.5 decades. And I know what happens in those cities. It's nice to say that stuff, but that ain't the case all the time, for most of the time.
So let me ask you a question. When you either you or somebody that you know goes for help in any of these places that I've mentioned, what are some of the adverse effects? What happens?
Listen, everybody gonna get back to you, right? But everybody don't get back to you with the right information.
Okay.
I know this for a
Okay.
fact. I've
Okay.
done this for over 2.5 decades. So I just want to bring this to it's nice to say those things, but that ain't what always happens in our communities, right? It's nice to say that the place on the corner don't sell good kale or good spinach, or you can't get this organic food in a Stop and Shop in my area. But where do I get it from? Most of our people who know what's going on go outside of our areas to get the health and the stuff that they need.
That's
Right.
that's fair to
So-
say.
Most of it.
Right. So the thrust of your argument or point is that there isn't enough manpower, or I should say human power, in the communities that you're referring to. There isn't enough human resource that is very familiar and lives in the communities that you're talking about, who care for the community that you're talking about. Am I correct? Am I?
Yeah. I think you got it.
Did I rephrase it properly?
No. I think you got it. I think you know what I'm talking about.
Okay.
It's absolute.
Okay. So that is in itself another kind of problem that needs to be solved.
Right. So I don't want us to keep,
resource.
I don't want us to keep continuing to say, let's go to these sources that are not serving us well.
Right. Okay.
We got you. We
So
got you.
that has to be elevated to the right channel.
And we should say that is a driving force behind this particular program, and why
Yes.
we have trained
Yes.
Mr. Bowen and
That's-
Mr.
that-
Lee as well.
Yes.
Exactly. That
We-
that
we-
is
Listen,
It's
listen.
this
All I
exact
want to
platform.
do, listen. All I want to do is bring it. If we're here having an honest conversation, let's have an honest conversation, right?
no.
I just want to say that I haven't heard that being said, and I want to put that out there because I am an advocate of the community. I've
Yeah.
been part of the community for all my life. I
Yeah.
see what's happening in all of this stuff that we're talking about, and I just want to bring it to the forefront.
Well, we're glad you did, because like Farah said, part of this effort, this Know Better, Live Better, is to gather information and prepare recommendations for another unit or authority to look into what you've described.
Yeah,
So
perhaps to
that's
be
part
more
of, we are collecting information to do research on the needs of the community. That's a critical part of this endeavor.
Yeah, so we should be explicit. This program is, the conversations from this program don't kind of go into the ether. We are kind of collecting them cumulatively and using them to make a community-driven report, because we do agree that I think a lot of the resources that are allocated are perhaps not taking into account kind of the holistic community concerns. So we do want to make sure that some of these systemic challenges that you're addressing are addressed, but in a way that is informed by community concerns, not by someone who's in a leadership role who's heard only a few choice perspectives.
Yeah, but what I really want to convey, and I'll leave it at this, right? Don't think that all of these resources that you're talking about, that people in our communities don't try to take advantage of. They do. They are just met with so many adversities.
You're right.
That we're not considering, that I think we need to think about, right? And we can come to this table and have these conversations and then begin to talk about, like, schools ought to provide this, communities ought to provide this, community service should provide this. But that's not what's really happening for most of our people. And that's what I want to put on the table.
And to your point, Irv, and thank you, because I think that's why it was so critical for not only, our chapter, but other hands-on frontline community-based organizations taking this information, compiling it, and then bringing it to the Department of Health. The Department of Health will sit down with our legislators, our elected officials, and like really say, look, this is what we've been discussing over the past 6 to 9 months, and this is what we need in order for us to start leveling the disparities that are going on right now. So that's what this is all about. Before we move on, Peter Conroy, we see your hand up. And you're muted. Yo, Peter, we can't hear you. Look like technical difficulties with your mic.
How about now?
There we go.
Gotcha.
Okay. Good evening, everyone. My name is Peter Conroy. I am the Health and Wellness Chairman with Kappa Alpha Psi for the Northeastern Province. I actually stepped into the position that Andre Early used to fill. I'd like to share a little different perspective. I am disabled, and I have a insurance plan on Medicaid, and it parallels a lot of the discussion that we're having. We did talk about human resources, but it's also it's a financial thing. For me, many problems in America simply boil down to lack of financial resources. And to illustrate what I mean, I was looking for a specialist for a doctor who performed a particular type of service, and went into my insurance platform, clicked on their Find a Doctor. I was given a list of about 100. I must have called 50, and all of them said, "Nope, sorry, we don't do that. The database is out of base. We don't take that insurance." None of them took the insurance. I finally ended up having to find not a doctor, but a nurse practitioner who barely seems to speak English, but thank God she's willing to do business with people with this insurance plan. So what I think needs to take place is what I see in parallel and needs to be expanded, by the way, in the housing market is fair housing. Doctors need to be mandated by law to take 10, 15, 20% of their patients who are low or disabled or on Medicare or something like that. They need to be forced to take a certain percentage of their patient base from this population in order to increase the human resources aspect that Irv had already been talked about. But in doing so, it also increases the financial aspects, because it opens up that many more opportunities for services. So I think some creative ideas, have really been shared here, but in addition to the human capital that is missing, you can have 1,000 caseworkers, But if they're all referring you to, a pool of 5 to 10 doctors, that's not going to work. That pool of doctors needs to be expanded from 5 to 10 to 1,000 to 2,000 or something like that. If we don't have the human capital and we don't have the financial capital, it's just not going to work. The last point that I wanted to say is I am very vocal rather about, and I see this especially in healthcare, the popularity of discussing zip code inequalities or location-based inequalities. This is a privileged way. This is a tiptoeing way of avoiding to talk about racial and socioeconomic disparities, but really racial inequalities and racial disparities in America. Thank you.
Thank you. Thank you. And this is it.
Y'all want me to say anything else? Thank you, Peter. I appreciate everything you just said. And absolutely right. Absolutely right. We like to paint this pretty picture, right? And some of us, perhaps most of us, if not all of us on this call are privileged. Like, we know enough to be able to navigate the system, and we got privilege, through, I don't know, our mama, our daddies, whatever, and we've been able to deal with this situation. But the people we serve don't always have that privilege, right? Everything that I talked about today, I know where to get good food at, right? I know how to get good health care. I know how to do all of this stuff. And believe me when I tell you, I come from Birmingham, Alabama. Believe me when I tell you, my mother was a single parent who raised me to be educated enough to be able to deal with this stuff. I know how to do it. But not all the kids whom I've heard about, the 1.1 million kids of the New York City Department of Education, parents and kids know how to do this. They don't. That's who I fight for on a daily basis. That's who I go to work for. They don't know it. They can't do it. But again, as I said, we who are on this call are privileged to be able to navigate this. And I don't like that pretty story because you know what? It ain't pretty. Not when I go in front of those kids on a daily basis and see their struggles, see their parents' struggles, go into the neighborhoods and see that they don't have access.
Well, thank you, brother. And
thank you, like seriously,
honestly,
thank you.
yeah. And this is with everybody on this call. Oh, go ahead, brother.
No, I just want before, because I know we are coming down to that time. And I know Farah did put the link into the chat box in regards to the post-session evaluation. Some of the critical information that was shared today from Irv, from Peter, all that information needs to go into this post. I mean, we're taking notes. We're taking notes, but we're also, it'll be critical to put some of that information into that post-session evaluation so we can digest it and take it to the proper people. It's interesting that you brought that up, Irv, because if you recall, a little community center that I was responsible for a few years, that community center was built in that section of the Fairview section of Greenberg for exactly what you were talking about. And across the street was a shopping plaza that had a decent, I'm not going to say, top shelf, but it had a decent grocery store. So for those that had transportation issues and things like that, they could just walk over, do what they need to do, Well, you know, that grocery store disappeared damn near 20 years ago. Has it been replaced? No. Oh, I'm sorry. It was replaced by a shoe store. So it's still, the fight still continues.
Right. Yes, it does. And
You
no,
got that?
yeah,
All
so
I want to
if
say
everybody
is,
could, go ahead.
all I want to
Yeah.
say, we love a good story, right? And we can go up there and promote all this good stuff, right? And I truly believe that there are some good stuff that is happening. But let us not be the people.
Did he just freeze?
Yeah.
He just froze. Okay.
Yeah.
So, all right. So, as we tailor to the end of this spirited discussion, so much great information. I want to thank, Farah and Kwaku who are still with us, and of course Dr. Hewlett and Erica that had to leave. I want to, and I know he's gonna have some words, but I want to at least introduce our Polmark, Derek Griffith, who's going to share some information with us.
Yes, good evening all, and thank you, Brother Early. Thank you, Brother Bowen. Excellent job as usual. Thank you all for joining this forum. We had this forum a couple of weeks ago, and we had a great discussion, and this is just piggybacking off of that last discussion, which was really, really good. Thank you, Farah, Kwaku. I know to your point, Brother Early, Dr. Hewlett and Erica had to drop off, but I just want to thank them publicly as well. One of the things I like to do when we have these forums, just go over some of what we discuss, right? Quick high-level overview. We start off with the healthcare disparities, the differences, how African Americans suffer more, right? And I think we realize that, and that somewhat ties into that zip code-based inequalities that Brother Conroy talked about. Higher death rates in the African American communities, lack of information. We talk about the trusted messengers also, and this is something we talked about on our last call. So you have to trust those messengers and who's delivering the messages. Sometimes, yes, we do rely a little too much on what's on the internet, right? You have to really sift through that information and identify what's true, what's not true, what should we discuss, what should we run with, what should we leave behind, right? And it's all about building that trust. Right? Trust is built on relationships. That's another thing. This is the second time I'm hearing about this. So that's key. We need to make sure we take that back, take that away into our families, our communities. We talked briefly about possibly having to continue to get these boosters. It's going to be like a flu shot. Brother Early, I'm in the same boat as yourself. I got the flu, then I got that flu shot. I said, listen, I'm taking that every year. I mean, I feel horrible after I take it. I'm down and out for a couple of days, but similar to like the COVID vaccine, but I go and I take my flu shot. What's really being offered in terms of help in our communities? We want to continue to look at that, and that fair housing. And again, Brother Conroy brought this up. That's very important because everyone doesn't have the same opportunities as each other when it comes to fair housing. And I really like the fact that you mentioned that some doctors should be mandated to take some patients that may not have, coverage or may not be as well off as others. And I personally know a doctor, and I'm not going to call him out. And we had that discussion, and that's one of the things that he does. And I know a lot of doctors don't do that, but this particular doctor, and some of us know him on this call, we were just having a general conversation, and he says, hey, yeah, I do take some customers, some patients, I should say, that don't have the coverage to get these surgeries done, and they'll do it. So that's good to know that he does that. And there are some doctors out there that do extend themselves to that point. So again, I just want to thank everyone for joining. I know we have another session. I'm not sure if it's next week or the week after, and tell your friends, tell your family, tell people you communicate with, extend to your network. Invite people to this call because as you see, we have some good conversations, very good dialogue. And I thank all the dialogue that we've had, even looking in the chat, it's a whole nother conversation going on in the chat. So just continue to join us. And I just want to, again, thank you all for being a part of this forum.
Thank you, Brother Paul Mark. Kwaku, did you want to have a word or two before we leave out?
No, well, I just to underscore what the gentleman, Irvin, that's his name, the educator, Irvin, you're right. To underscore what you said. Yes, this process here is not just educating, it's also to find out. Because when you're educating, like you are an educator, you don't just give, you also listen and upgrade yourself. So that's part of the system. We're providing information, but we are also listening to the feedback and collecting all that information. Believe me, Farah has a form. There's a form, and I do what she does sometimes in person. There's a form that we have. We put down questions and concerns of participants, and we're collecting all of that. And at some point, it's going to go into a research format and recommendation, action, etc. So this is not ending here. When 8:30 comes and we go offline, that's not the end of it. This is just the beginning of it. I just want to reassure you that we'll pick it up.
Yeah. So I just want to thank all of you, and I just want to. I don't mean to offend anyone, but
no. We are not offended.
No. I just want to finish. I'm passionate when it comes to conversation about our community, our kids, what we're doing, and hey, I clearly understand that there are a lot of good things that are happening, but there's not enough, and we need to address them. And we can't paint a pretty picture when it just ain't pretty for enough of us. It's just not. And I'm not that guy who's gonna come on and hear this. I'm in it. I'm in it. Again, when I talk to you about privilege, I happen to be privileged. And that's only through the sacrifices in my education as opposed to what a lot of our communities go through. And so thank you, Andre. Thank you, Brother Bowen, for pushing and getting me here tonight, because Lord knows I will be here the next time. Just let me know.
Well,
we will definitely let you know.
We thank you for your input and your energy, because it was definitely needed. And to your point, mentioned earlier, we do have another session coming up, and that one is going to be centered around mental health, a topic that you, myself, Brother Bowen, and quite a few others are very passionate about, because it ties into, as you mentioned earlier, what are the adults, what kind of support, what type of energy, what type of attention is given to the adults that actually have to navigate through all of this so they can be there for the kids. And that's going to be, I get the strange feeling, another hot topic. But I'm glad from a personal perspective, I'm glad that as a Black man, that we are openly having this conversation about mental health. Yes. We're not going to go ahead and pray and just sit back and just wait. We're going to pray, but we're also going to get off our butts and do something about it, because we definitely want to be there for our communities, for our families, and for those that we care about. So with that being said, ladies and gentlemen, thank you for being with us yet again.
Thank you again.
This was amazing. Rob, as always, and close us out.
Again, Thank you everyone for the call and just getting on here. As you can see, every session that we have, this is it. If this is your first time here, we do this interaction. We are not here spitting just information to you. This is a dialogue. This is a conversation, not just with us, but with health professionals. And we're not just sugarcoating things, but we're giving you not just real stats, but real information and having those real conversations. And we're going to have another one on July 20th. And if you're free, we would love to have you here. Okay. And like I usually always do at the end of these sessions, I always thank Brother Early because he tells me what to say. I don't know what else to say unless he writes it down for me. But we thank you all for coming here tonight. And I can't wait to see every single one of you here July 20th. If you're free, please come, because just like today, it's going to be a spirited discussion. And that is the goal.
And invite someone.
Invite anyone, tell them to come and let them know that by the end of it, they will know that they were part of a discussion, right? Not just a Zoom presentation, that you were part of a discussion, a very important one. So with that, I wish everyone a great evening. I look forward to seeing you all soon.
Thank you. Have a great